So today is a heavy day for me. May 6th. May 6th, 2026 marks 15 years since I lost my mom to a heart event. May 6th was a Friday in 2011, and Mother's Day was that Sunday. I was flying home that very day to spend the weekend with her, which was going to be our first Mother's Day with me pregnant with my first child. And that didn't happen because of a heart event. And that has shaped me in so many different ways, from how I practice medicine to who I am, to even how I move as a mom, how I move as just Crystal. And with this month being Women's Health Month, I just wanted to share open, honest discussion about what heart disease has meant to me, how it's affected my life, from losing my mom May 6th to then losing her sister in October of that same year to cardiovascular disease, and then losing her mother the following month in November of 2011. And then to fast forward to find myself in heart failure by March of 2012. Not only has heart disease affected my family, just community people that I've grown up with, from church, family friends that we've had, friends of friends that have lost, and then their patients that I've unfortunately lost. So my practice is now 5 years old, and part of the reason that I transitioned was wanting to be able to practice medicine in a way that I had more time with people to really investigate root causes, to really look at some things that may not be traditional, quote unquote. What other things are we missing? And it's been a pleasure to have longer conversations with people, get down to some things that we may not have explored by only having 10 to 15 minutes in a visit, and really being able to address concerns when they're yellow flags and not red flags, or no flags and then events just take you out. So when I say that I am voicing things about metabolic health, and I'm posting about stress, and I'm posting about metabolic dysregulation with insulin resistance, and how beneficial GLP-1s are at helping to improve insulin sensitivity, to help improve cholesterol levels, to help improve blood pressure. It's not just a quick fix. It's not simply a weight loss drug. It's so much more than that. GLP-1s have been shown to decrease the risk of cardiovascular events. Same thing with hormone replacement therapy now. We're seeing, we understand that cholesterol is affected by the loss of estrogen. And when started within 10 years of menopause, women can decrease their risk of cardiovascular events by 50 to 60%. We have to have these conversations. We have to. There have been too many people who've been lost by not properly addressing things when they were yellow flags. And some things we didn't know, and some things we didn't have treatments for or being able to use as interventions, but now we do. And when we know better, we have to do better. Do we always want to take a pill for something? No. Who does? But when our body is saying that that is what it needs, it's our responsibility to take care of our temple and do the things that we can do. And it's starting early, before we've had the stroke, before we've had the heart attack, before we've had the heart failure. We have to be proactive. We have to start younger. We have to have these conversations earlier in life and really begin doing those things that can make a difference. And so that's where I am. Now that my daughter is approaching her 15th birthday, I want to be here for her. So when my blood pressure started going up, did I want to have a blood pressure medication? No, I didn't. I tried more exercising, even though I was doing some exercise. I tried doing more nutrition things, even though I was doing some great nutrition things. But my body was saying it was not enough. And if taking a pill is going to keep me here off of dialysis because my lower blood pressure is preventing me from having kidney disease, decreasing my risk of stroke or heart attack, and I can be here to watch Caitlin grow up and have her children and enjoy playing with her children because I'm not debilitated because of a stroke, or I'm not so fatigued because I've had a heart attack and I can't walk across a room, then I have to do that. I have to do that for her, for what I want to be to my family 10, 20, 30, 40 years down the road. So as you're making your decisions about what things you will and won't do, think about where your life, where you want to be in 20 to 30 years, and honestly do an assessment of what evidence says can support you the best to get there. You have to listen to your body. You can't shrug it off. You can't be too busy. You have to take the time to take care of your temple, because if you don't take care of it now, it's going to begin to continuously fall down and not sustain and be able to keep you doing the things that you want to do and be the support person that you want to be. So, if your mom is still here, love on her. Encourage her to get treatment. Encourage her to check out Yellow Flags, your sister, your aunt, the ladies in your life. Get those concerns checked out. Don't just pass it off. Get it checked